Hi everyone, and welcome to this little event that we're having to understand hospice and palliative care. My name is Colleen Daniels. I am representing Seasons Hospice and Palliative Care. We are a nationwide company that provides these services to our most vulnerable populations. I'm just going to take a little time today to discuss the differences between palliative care and hospice care and what those things can provide in order to give a little peace of mind, and some stress relief to patients and caregivers, especially during this difficult time that we are facing in our nation today. So I'll start with palliative care and what that actually is. So palliative care is pain and symptom management for people who have a terminal illness, and that is at any stage of that illness. So palliative care allows patients to still seek curative treatment while having a physician, usually a nurse practitioner, overseeing pain and symptom management to make sure that the patient is as comfortable as can be. Most of the time, palliative care is not done in a home setting. It can be, but it's generally done in a setting of a assisted living, or maybe a memory care, maybe a skilled nursing facility. Those types of places are where Seasons usually does palliative care. There are a few companies out there that do provide it in home, but palliative care, the two big differences between palliative care and hospice care are, one, palliative care is a lot less robust care. So like I said, you generally have a physician or a nurse practitioner seeing you maybe every 2 weeks to manage medications, treatments, things like that, see how you're doing. Of course, making sure that you are comfortable in whatever setting you're in. And also, there's no time that palliative care is in. So, meaning hospice care, in order for hospice care, is generally written by a physician when that physician feels there are 6 months or less for that patient to live. Of course, that's not an exact science. There's no way to say that is going to be the extent of a patient's life, but that is what the physician will say is a best guess as far as the lifespan of that patient at that time. So palliative care, there is no time. Hospice is generally written when there's 6 months or less believed to be in the patient's life. So a little bit about hospice care. Hospice care is, the main philosophy of hospice care is to live fully at end of life. So that means that, great question. I'm going to get to that too. That's on my little list of things I want to address, the eligibility for hospice for sure. So about a third of deaths in the United States do happen in a hospital setting, which very much contradicts what most people generally want, is to be at home. Hospice does that. It provides that type of care because hospice is not a place, which most people think it is. It's not a place, it's a service. So we go to wherever you call home, whether that's in your house, whether that's in a facility. Even we do see patients in the hospital as well. So it's wherever that person calls home. So eligibility for hospice is really important, and that's something that is the main Medicare guideline. So there are a quick list, if you say, where we look at ALS, AIDS, cancer, end-stage renal disease, chronic kidney disease or acute kidney disease, renal failure, pulmonary disease, heart disease, dementia is a big one that we've seen a ton of growth with. And actually now we have COVID as a hospice diagnosis as well, which is new, obviously. Along with those diseases, there's usually a group of things that we call prognostic indicators, and those indicators basically are showing signs of decline. So especially with dementia, that's a big one, because as we all know, somebody can have dementia and be very stable for years and years at a time. So they look for these prognostic indicators. Those are things, for an example of weight loss, infections, hospitalizations, falls, pressure ulcers, cognitive decline. Usually there might be something like a recurrent UTIs or pneumonia, things like that are saying, okay, our patient was here 3 months ago and now they're here. And we know with those signs of decline and along with that terminal illness diagnosis, they're not going to get better. They're not seeking curative treatment. They're not wanting to keep going to the hospital for the same thing, sitting in the emergency room for hours on end. They just want comfort. They want symptom management. They want to be home and they want comfort. As far as once you start hospice, do you ever go off hospice? Another great question. Yes, we do have patients who come off of hospice services, and with that, we do what we call like a recertification basically every 3 to 6 months. And if our patient on hospice services is improving or seeking some aggressive treatment, absolutely. There's nothing contractual about hospice. We may even say, we don't feel like hospice may be the best course of medical treatment for you right now. And we can do what we call like a revocation of hospice services, where you sign a piece of paper and then hospice services end. And if at some point you choose to go back on to hospice services, you absolutely can. There's no penalties. There's no huge process or anything like that where you have to answer a bunch of questions or something. As long as you qualify for hospice, again, with that terminal diagnosis and the prognostic indicators, like I said, weight loss, infections, hospitalizations, things like that. And it doesn't have to be all of those things. It can be 1 or 2 of those things, but my general rule of thumb is that if you're looking into hospice services, it's probably the best time to enroll in hospice services. Like I said, you can always come off of services if it's not the best time. But if you're looking into it, or your doctor has recommended it, or something to consider, starting the benefit as soon as possible is always the best way to go to get the most out of what we can provide. So just a general rundown of what we do provide. So everything's overseen by a physician. Generally, it's a hospice or palliative care physician on our team. You have your nurse case manager who sees you. You have your aide, so your own personal aide to do personal care, bathing, grooming, shaving, hair care, nail care, all of those things. We have a social worker for anything maybe non-clinical, everything from doing FMLA paperwork to end-of-life planning, grief and bereavement support. We also have services such as volunteers who work on great things like legacy projects that are amazing and truly beneficial for family members. We have music therapists that are board certified music therapists that provide music therapy as a way to control and manage symptoms. And then we also have things like chaplain services if somebody's spiritual or religious or just wants somebody to talk to. So all of those things are kind of combined in a plan of care for the patient based on what the patient wants, what the family wants, what the needs are. So there's a series of visits. Like I said, hospice is not a place, so it's visits to wherever you call home. In addition to that, we are 24/7, 365. So in order to avoid things like further hospitalizations, our call center, which is manned by registered nurses 24 hours a day, is available for you to call. And if there is some sort of issue, say a pain crisis or shortness of breath or even just some anxiety, our nurse will come right out to see the patient, support the patient and the caregivers, and make sure that we get that patient comfortable at home, wherever that is, and that they have everything that they need and that the caregivers have everything they need too, because it's a very holistic approach to care in that we're not just focused on the patient, but focused on everybody involved in that patient's care. One other thing that I wanted to mention was as far as payment goes for hospice services. So hospice is a 100% covered benefit through Medicare. If there's no Medicare, we do accept, Seasons does accept pretty much every insurance from Medicaid, Blue Cross, everything, Aetna, all of those different services, insurance companies we work with, and it's 100% covered benefit. So just a quick rundown on that. The benefit does include all of our services, visits, care. We also provide medical equipment, medical supplies, such as maybe wound care supplies if somebody has a wound or multiple wounds, incontinence supplies. We provide all of those things as well, plus medications. So, and all those things are now going to be delivered to you or to your home facility, wherever you are. And those things we manage. So as far as medications go, I know there's usually a lot of questions about medications in hospice, and all medications that are related to a hospice diagnosis and or comfort are covered 100%. So if there are medications that Medicare does not deem necessary for their rule of thumb, of course, is the 6-month time frame. So say there's a cholesterol medication that you have on board. Medicare isn't going to cover that on the hospice benefit. If you felt the need to continue that medication, you could go ahead and get that however you're getting it now. It's just not something that we're going to pay for and deliver to you. Yes, hospice it's a wonderful benefit. It manages really everything, because again, you're looking at the holistic approach of patient, family, caregivers, extended family members that we offer grief and bereavement support to. We have at Seasons a great children's program called Camp Kangaroo that manages grief and bereavement for even children, grandchildren, anybody in that age range that needs a little extra help and support and a little extra love. That's what we do. So again, I hope that covers a good rundown of what we do. If there's any other questions, go ahead and shoot them out there, and I'll be happy to answer them. So palliative care does not cover the same things. So it's a different program in that it manages medications and it manages the care provided by the nurse practitioner and or physician. Usually it's a nurse practitioner, but it doesn't cover all the other services, all the other things like equipment and medications and things like that, because palliative care is a lot more open, and you're still able to see your say maybe your oncologist to get chemotherapy, or your physical therapist to continue to do physical therapy. So Medicare says that palliative care is just going to focus on things like pain management, symptom management, and the nurse practitioner that manages that. Now, I will say that it happens very often that when somebody's on palliative care, the nurse practitioner will generally feed that through to us once there's kind of a point where palliative care just isn't beneficial anymore because they can't seek any other treatment. If you're total bed bound, does the family also need private care? Okay, so that's a really good question too. Like I said, hospice does not provide in-home 24-hour care services. So we're available 24/7, and obviously we'll be there if there's any sort of situation where we're needed for support or pain management, any kind of symptom management, things like that. And then it's just a series of visits. So it happens that with hospice support, a lot of people are generally okay with the care at home with family or something, just to make sure that they don't have to go out to the hospital. We're a phone call away. We're doing visits and managing care and making sure that somebody is comfortable, so hopefully there aren't crisis situations or anything like that. But if you do have somebody who the family, for whatever reason, cannot provide that 24-hour care for things like changing and moving and things like that, absolutely there may be a need for a private pay, private care provider. So our social work team and nursing team will always assess for that and make sure that those needs are being met if they're needed. So you should always talk to our nursing team, our social work team, because they can also give you a lot of referrals and good sources. And we work with a lot of good people. I know there's a lot of great companies with Navigate Home that we also can send out referrals for that type of thing too, because absolutely sometimes it is needed. My contact information website too. The www.seasons.org is our website. My best suggestion is calling our 800 number. So that is 800 370 8592. Absolutely. And again, that's 24/7. We're always here. We're always available. Hospice never sleeps. So absolutely. My name again is Colleen Daniels. I'm a hospice care consultant. I meet with families, do a lot of education and support. And again, we have a great team too. So I'll leave it open just for a second if there's any other questions. But let me, I think that's all I have. I'm trying to think of another way to contact. I know we have a referral app that you can go into the App Store or the Google Play and just look up Seasons Hospice, and we have a great referral app that has free education on it. It has a list of all the prognostic indicators for every terminal illness. It has our contact information, and you can send a referral right through the application too. So that's a great thing, and I'll also make sure to post any other way to contact us if you guys have questions or anything like that that we can answer, or if you want to send a referral just to see if your loved one needs our services, or if you're a referral source, assisted living or anything like that. If you have a patient that you feel might need to get assessed, we can absolutely do that anytime. So I appreciate all of you. I hope that was super helpful. Again, I know that's a lot of information. So again, reach out with any questions. Oh, so COVID, yes. I will say there are hospice companies out there that don't see COVID patients. We have since day one. We have always been there to support our COVID patients and loved ones who do have COVID. We are very respectful of COVID guidelines. We do obviously provide all of our own PPE equipment. We have multiple patients with COVID, and we've had family members with COVID too. Of course, we may have to make adjustments to visitations or things like that, just to make sure that our staff is safe and that we're not spreading it to other patients or things like that. But we absolutely do. And like I said, COVID is an actual hospice diagnosis now. So that's something that we work into our plan of care and make sure that, everybody is supported that needs clinical care at this time. So I appreciate you guys. And like I said, hopefully that was helpful, and please reach out with any questions or concerns or thoughts, or anybody you think may need a little help or extra love these days. So have a great Thanksgiving holiday. Reach out with any questions, and have a good day. Thank you.